in the United States which showed that if one used sunscreen for 2 years, you can decrease the amount of precancers by over 50% immediately following that. So it's the first time they've actually shown that by using sunscreen, you can dramatically reduce the number of precancers and subsequently the number of cancers that people get.
And I have a particular prejudice about this too. There is no safe sunburn. There is no safe suntan. Tanning salons, I think, it amazes to me that they're unsupervised and ungoverned. That people who go to tanning salons and think that they're getting a safe tan are mistaken. That the same ionizing radiation that one will get from the sun is available from sun tanning salons and should be avoided at all costs.
Well, that's quite a statement.
I know. I'm sure that very soon there'll be hate mail from the industry.
Yeah, it could be. Well, you were talking about the sunscreen and this thing called SPF.
SPFs above 15 or 20 are somewhat suspect. I mean, I've seen preparations 35, 40, 50. I'm not so sure that anybody could say with any degree of certainty that is accurate. But I prefer to have my patients not deal with SPF and have total blocks. Zero radiation.
Just anything above SPF of 30 recently at the recent consensus conference was viewed as being non-helpful. So that SPF of 30 generally blocks over 98% of the sun rays. Putting on a higher amount doesn't block any significant degree more than that. The only advantage would be how often you'd be reapplying it. We recommend reapplication of sunscreens every 2 hours, and at least putting on an ounce at a time, so therefore you can have enough for your entire body. Most people don't put on enough sunscreen. That's what I find, that people try to use the same bottle for the entire summer, and they really need to be...
I think I'm guilty of that.
Right.
I agree entirely, and it's also important to temper the amount of sunscreen based upon your activity. If you are playing tennis and sweating profusely, then your needs obviously will increase proportionally. If you're going swimming and washing it off, then they have to be increased proportionally. There are some sunscreens which are allegedly waterproof. However, I would think that to err on the side of caution and apply sunscreen every time you come out of the water. Makes good sense to me.
More common then, what about a golf game, which is 4 or 5 hours in the sun, people? What about skiing, which can be also 4 to 5 hours?
Well, skiing presents a unique dilemma, because what people don't realize is that the snow reflects up to 80% of the rays of the sun. So they're getting incident rays both from the sun coming down as well as from the snow reflecting back up at them. So therefore, when one goes skiing, one has to be extra careful as to sun rays. The third reason why is because as one increases in elevation off the ground, the amount of sun rays are more intense. So you're getting greater exposure from and you're at greater risk when one goes skiing, as well as the wind. The wind factor itself, the friction from the wind, increases the damage to one's skin. So one should be very careful when one goes skiing, and one should use extra applications of sunscreen.
And what about for children? I mean, we want our kids to go outside and play, like we did as kids, and frankly, I mean, when I was a kid, or when my own children were children, with the exception of the beach and then later on skiing, sunscreen wasn't even a factor.
It's very difficult with children, and I'm guilty of with my own 8-year-old of not applying it as often as I should. But I think we have to be conscious of the fact that children are active, they need regular applications, and also, as we stated before, the amount of ionizing radiation that you get when you're 2, 3, 5, and 10 remains with you, and the consequences of that radiation become apparent at 30, 40, and 50.
Presently, in the United States, a recent study said that less than 40% of all teenagers use sunscreens appropriately. A lot. They may occasionally use it, but less than 40% are using it regularly. So we have to try to educate the masses, and that's this show serves that purpose, that all the people watching should make sure that their children do apply sunscreens. And I think avoidance is a very healthy way to think of. You can go to the beach early in the morning before 11 or later in the afternoon after 3. It's the beach is full time.
Is it proportionately more healthy to do that before 11 and after 3? I mean,
yes, the rays are less intense at those times. So therefore, if you go to the beach at those times, you're at much less risk. And if you use appropriate sunscreens, appropriate protection, appropriate clothing, then you're appropriately protecting yourself, and you drastically reduce your risk of getting skin cancer.
But it is a dilemma, and most adolescents feel that they look better with a suntan,
Sure.
and that it symbolizes an active lifestyle, which is very attractive. It's very hard to balance that with the consequences of ionizing radiation when you're 40 or 50 years old. They really don't care.
Well, the George Hamilton look, you know,
Exactly.
constant, consistent tan.
Yeah, well, he's going to be one of the first face transplants then.
Very well could be. Is any of the cancers that we've talked about hereditary?
The hereditary issue that causes me the most problem, and perhaps you too, is a syndrome called dysplastic nevus syndrome, which are acquired nevi, acquired pigmented lesions, which, as Dr. Fox had said, have irregular borders, irregular pigmentation, multiple, greater than 4 to 6 millimeters, and are all over the bodies of certain people, and it is tragic. And there is no real answer to how to deal with these other than surgical excision, which ultimately produces an unhappy, scarred patient. However, and these are usually young people, so that it becomes a very, very difficult task to convince these people that, you know, we really need to remove these nevi, that they have an enormous potential for developing malignant melanoma, yet at the same time we're going to...
I need to cut you off at that point and thank you both for the sound and expert advice on what to do in this summertime and actually all year round. Thank you very much, doctors.
Pleasure.
Thank you.
I'd also like to thank our viewers for watching, and if you'd like more information on skin cancer and what we've talked about today, you can log on to the CHS website, which is www.chsli.org. That's O-R-G. I'm Roland Smith, wishing you a goodbye and certainly good health.